and we So hello, good afternoon, good evening to everyone joining us today. If you are new, welcome. If you've joined us before, you may be surprised to not be hearing Charlie's English accent today. I am replacing him today's webinar. I'm Laurence, a health coach with LyfeMD. For those of you who don't know me, and I'll be hosting today's webinar, which is all about physical activity for inflammation relief. So I'm excited to bring you this topic today, which I think we can all learn a lot from. Jeff and Alex will be bringing the topic today. We'll be talking all about physical activity for inflammation relief. So we have also received a lot of juicy questions, which we will be answering at the end. If you have questions you would like answered, please pop them in the chat and we will do our best to answer them on the call today. So you don't want to miss that. Make sure you do stay till the end because we're going to be answering all the questions. But without further ado, let's get this webinar going. So I'd love for you to get to know our speakers and presenters today, Dr. Jeff Vallance and Coach Alex Egert. So I'll let them introduce themselves first before we dive into the topic.
Sure, I'll go first. Thanks, Laurence, for the intro and the welcome. My name is Jeff Vallance. I'm coming to you from beautiful Kimberley, British Columbia, kind of on the opposite side of BC from where Laurence is, but it's a little chilly today. It's actually down to 4 degrees and we had some snow, but that's good. We kind of need all the rain we can get. So I'm a professor at Athabasca University in the Faculty of Health Disciplines. I've been there for approximately, I think I'm in my 16th or 17th year. And throughout all that time, I've been researching the area of physical activity and chronic disease.
And hello, my name's Alex. Welcome to everybody coming in. And yeah, so I'm a coach with LyfeMD. I've been working with LyfeMD for about 2.5 years now. So if you've ever taken advantage of the coaching services, we may have chatted before. So hello to all the familiar names and faces. I have my Bachelor of Science in kinesiology, and I'm currently in graduate school to become a chiropractor. So I'm from Canada. I grew up in Alberta, but I'm currently living in the United States doing school. And yeah, physical activity and it is really a passion of mine, and seeing people explore different ways to be physically active. And yeah, I'm just excited for the talk we have today.
Is this for me, Laurence? Are we heading?
Yeah, if you guys want to get started, let's
All right,
do it.
sure. So yeah, first off, just want to thank everybody for attending these exciting LyfeMD webinars. I've done a few of these now. In full disclosure, my co-presenter Alex here is actually my nephew. So this is kind of exciting. It doesn't seem like that long ago we were sitting playing Xbox or PlayStation, and now here we are co-presenting. So this is also a proud uncle moment with me being a kinesiologist by trade as well, and then he's kind of gone down this path too. So it's certainly really exciting. I'm going to start off the presentation by kind of setting the stage for physical activity and inflammation. I want to give you a bit of a background on physical activity and inflammation, as well as fill you in on the current science. I wouldn't necessarily call myself an expert in the area of inflammation. I've been a researcher in the area of physical activity for 20 plus years, but most of my research experience is in the area of physical activity and cancer. And I've done some research in other chronic diseases, including IBD and stroke survivorship. So the first few slides, I want to just kind of set the stage and kind of get us all on the same page with respect to what is physical activity and what is inflammation. So it's important to define these terms. And the first definition we're going to go through here is what is physical activity? A lot of the time it's confused with exercise, and sometimes we use those terms interchangeably. But there are some key differences. Physical activity is more of an all-encompassing term, which is defined as any bodily movement produced by the skeletal muscles, that result in energy expenditure. So gardening, housework, biking, walking, those could all be classified as physical activity. You're expending energy, you're moving your body. But exercise is a little bit different. And I like to think of exercise as a subset of physical activity. If you think of physical activity as an umbrella, exercise would fit nicely under that umbrella. So exercise is a type of activity that's more planned, it's structured, it's typically repetitive, and it usually has the objective of improving physical fitness. So of course, probably what's coming into everybody's head here is things like going to the gym or going for a run or swimming laps. You're planning it, you've got an objective, and there's usually some fitness or health outcomes that you're achieving with exercise. So Laurence, if you want to go to the next slide. And we'll talk a little bit about inflammation. So inflammation is a commonly used word in medicine, but the meaning of inflammation is actually quite variable. It's a little bit fuzzy and it's inconsistent because there's really no consensus definition that has ever been arrived at. It's really a catch-all term that's used to describe many situations. So inflammation is actually part of the body's defense mechanism. It can be a good thing. So it's there to protect you and help you get better. So your immune system will recognize and remove harmful stimuli, and then the healing process begins. And the best way, probably the best example of this is if you have a bruise on your leg or your arm. You've hit your leg on something, or you have a Charlie horse and you've got the big purple splotchy bruise on your body. That is known as acute inflammation. So your body's received that bruise, or it's received a hit and it's received the bruise. And in response to this, the body starts to repair the injury, and the immune system kicks in and overcomes the damage, and the bruise disappears. So again, that's what we would call as more acute inflammation. But for our discussion today, we're going to mostly focus on chronic inflammation. So we've got acute inflammation, which is kind of a bruise or an infection of some sort. The immune system steps up, gets rid of it, and it goes away and you're all better. Chronic inflammation is a lot different, as my next few slides will show. Chronic inflammation is referred to as a slow, long-term inflammation that can last several months or even several years. In some conditions like arthritis, irritable bowel disease, your immune system triggers inflammation even when there's nothing to fight off, like virus or bacteria. We can't really see chronic inflammation, but we can certainly feel it. Chronic inflammation is associated with things like body pain, fatigue, depression. With respect to irritable bowel disease, GI complications like diarrhea, and even weight gain and infection. Laurence, if you can just go back one slide, I just want to talk about, maybe right there. I want the analogy with fire. And I think this helps to put the idea of chronic inflammation into perspective. Chronic inflammation can be understood by equating it to a fire. So you think of things like a controlled burn or a good fire. You think of wildfire prevention, they put all the debris together and it's a controlled burn. There's a fire and it goes out and things get back to normal. But sometimes in our body, we have unwanted debris. And in the body's case, things like pathogens or damaged tissue that need repair, regrowth, and regeneration. Ideally, getting rid of the inflammatory response happens within a few days or weeks. However, inflammation can fail to resolve or get better because of the persistence of the harmful inflammatory stimuli or the situation that's causing the inflammation. In this case, the controlled burn or the fire or the inflammation, sometimes it can smolder and it can turn chronic and it can last for days or years. You think of sometimes after the fire season, the wildfire season, they talk about fires burning underground And sometimes during the winter or into the following spring, those fires can pop up again. I think that's an excellent way to think of chronic inflammation. So inflammation or that fire can smolder. And secondly, it can also accelerate and spread like wildfire and damage and harm other healthy tissues and organs. So really what's happening in chronic inflammation is your body is trying to put out a fire that's not there. So if we go to the next slide, my trusty little graph, and I think this show really gives you a good pictorial sense of the differences between acute and chronic inflammation. The acute inflammatory response, or the green line, it's transient and it's programmed to resolve. And that's what happens in a normal state of health. But failure to resolve and get healthy results in that prolonged or chronic inflammation, which is characterized by constantly going in and out of flare or inflammation. So that fire burns, it goes out. Fire pops up again, it goes out. And when this happens, it can lead to a host of conditions, such as inflammatory bowel disease, cancer, type 2 diabetes, heart disease, and autoimmune disorders, such as rheumatoid arthritis or multiple sclerosis. Okay, next slide, please. So let's talk about inflammation and physical activity. And specifically, we'll talk about the anti-inflammatory effects of physical activity. So when it comes to physical activity and inflammation, there's often some confusion. You know, in other chronic diseases, and I'm coming at this from a cancer context where, you know, if you're diagnosed with cancer or if you've gone through your treatment and you're into your survivorship, you know, we know that any type of activity is good. Get out there, do as much as you can. There's really no adverse consequences to being active after having a cancer diagnosis. But when we're talking about inflammation, and especially things like lupus, arthritis, irritable bowel disease, there are some precautions that you need to consider when being active. So it's a little bit different than other chronic diseases that have been very extensively studied. So research suggests that physical activity can have both anti-inflammatory and pro-inflammatory effects on the body. So it can be good for inflammation, but activity can also be bad for inflammation. And it depends on a bunch of factors, such as the intensity of the activity, the duration of the activity, and even the individual characteristics of both the activity and the person. So if we can go to the next slide, Laurence. So just to give a bit of an overview of what the research says about physical activity and inflammation, really it's regular moderate intensity activity, which is associated with reduced levels of systemic inflammation. And I'll just say that again. It's regular moderate intensity physical activity that is shown to reduce levels of systemic inflammation. Physical activity has been shown to decrease circulating levels of pro-inflammatory markers such as C-reactive protein, or CRP, as some of you might know that as. But it can also increase anti-inflammatory markers like interleukin-10. So these anti-inflammatory effects of exercise are believed to contribute to its protective role against chronic diseases such as cardiovascular disease, type 2 diabetes, and certain cancers. But the exact mechanism by which activity exerts its anti-inflammatory effects, it's different in autoimmune diseases, and it's not fully understood, but it might involve several factors. And I'm going to lean on the irritable bowel disease context because that's probably what I know the most. So in the context of IBD, we know that physical activity can influence immune function, gut microbiome, intestinal barrier integrity, and also the release of anti-inflammatory cytokines, all of these which contribute to the observed improvements in inflammation and symptom management with regular physical activity for those with IBD. There's a very recent systematic review that just came out this year, I believe it was a month ago, in the Journal of Sport and Health Sciences. And what they did is they did what's called a systematic review. And a systematic review is a study that takes all of the intervention work that's been done and published in a certain area. So for this here, it's looking at the research on the anti-inflammatory role of exercise and activity on inflammation. And they look at all those studies and they synthesize them and they come to conclusions based on what the collective body of research is saying. So, we typically get, or the consumer typically gets research in the news, and it's a one-off study that comes out. A study found that this type of exercise is good for this, or this type of exercise might improve cancer. I mean, that's just one study in, there could be a body of work that includes 200 or 300 studies. And it's important to look at that collective body of literature. And that's what this study is doing here. So what they found is in the last 20 years, so it's looking at more recent research, there's been a total of 87 interventions that have tested exercise and activity on patients who have autoimmune disease. So that could be things like IBD, rheumatoid arthritis, lupus, and there's a few more, which my next slide will show. And overall, the summary of these 87 studies found that moderate intensity activity was the most common intensity associated with anti-inflammatory effects. Activities that were beneficial included things like aerobic training, resistance training, or strength training. And you've probably heard it before because I know LyfeMD promotes it a lot. Yoga. Yoga is one of the best activities that you can do for controlling and managing inflammation. So just jump ahead there, Laurence, and I've got this nice little graph. I didn't make this graph myself. I poached it from a research study that's out there. So this infographic summarizes the anti-inflammatory effects across the different autoimmune diseases that were included in that study. The slide's a bit busy, but I'll just direct your attention to a few specific spots. So if you look down on the left corner of your screen, you can see the summary for rheumatoid arthritis patients. And you can see anti-inflammatory effects were found for people with rheumatoid arthritis. And they saw that the most common activities that were associated with these anti-inflammatory effects were doing yoga on 5 days a week for 8 weeks, aerobic combined with strength training 2 times a week for 24 weeks. And if you jump over to the right side to the IBD summary, you can see that they found anti-inflammatory effects from aerobic activity 3 times per week for 10 weeks, and aerobic combined with strength training 3 times per week for 12 weeks. So the take-home message here is anti-inflammatory effects were not achieved by exercising 2 hours a day, 7 days a week, or lifting super heavy weights and training for marathons and ultramarathons. The activities that we're finding to be the most beneficial for anti-inflammatory effects are moderate intensity exercise. And we'll talk about that in the next few slides. And it's moderate intensity exercise on some days of the week. It doesn't have to be every single day of the week. So next slide, Laurence, please. So before we jump into moderate intensity activity, I want to talk about strenuous and prolonged activity. Another word for strenuous activity that you might have heard is vigorous intensity activity. So, and this is probably one of the biggest questions when it comes to activity recommendations for people with inflammation. Very intense activity or prolonged activity can actually promote some inflammation. And this is one of the main reasons that you need to practice caution when you're planning your activity program. Inflammation in these types of activities is often observed in endurance athletes or individuals engaging in high intensity training. It's common for marathon runners, triathletes, and other endurance athletes to experience symptoms, particularly in the gut is probably one of the most common areas. Things like diarrhea and bloating. And these intense exercises can lead to muscle damage, oxidative stress and inflammation, and that's part of the body's natural response to tissue repair. However, this acute inflammatory response is generally transient and is followed by a period of recovery during which the inflammation subsides. So if you want to jump to the next slide. So moderate intensity activity includes activities such as brisk walking. That's probably the most common form of moderate intensity activity. Other activities include yoga, cycling, or even swimming. And these activities are typically associated with these anti-inflammatory effects and improved health. In contrast, high intensity or prolonged endurance exercises can increase inflammation, particularly in untrained individuals who are trying to do too much too quickly or during periods of excessive training load. But regular training adaptations and proper recovery strategies can help mitigate these exercise-induced inflammation periods over time. So how do you know if you are doing moderate intensity activity or not? I know lots of people have an Apple Watch or a different type of smartwatch, and you can certainly monitor your heart rate. Strenuous activity is typically around anything above 70 or 75% of your maximal heart rate. But there's actually an easier way to monitor the intensity of your activity. And that's through what we call the talk test. And the idea behind the talk test is that the harder you work, the more breathless you become. So you're out of breath, and it actually becomes harder to talk. I think most of us have been there at some point during some forms of activity. And during strenuous activity, you find it difficult to talk, and you won't be able to say more than a few words without pausing for a breath. So during moderate activity, the guideline is you want to be able to talk. And some people say you should even be able to sing a song. So go to the next slide, Laurence. I've just got, I think, 1 or 2 slides left here, and then I'm going to hand it over to Alex. So I mentioned earlier that the patient or the individual and differences within the individual can lead to or determine the type of inflammation that you may experience. So responses to exercise-induced inflammation can be widely determined by individuals, and things like genetics or age or gender, fitness level, or maybe you have some other types of health conditions. These can influence how exercise or activity affects inflammatory markers in the body. And therefore, and this is my big plug for LyfeMD, it's important to have personalized activity prescription and monitoring. This might be necessary to optimize the anti-inflammatory benefits of physical activity and minimizing the risks that might come with inflammation. And that's certainly an area that the LyfeMD team and their coaches can help with. And just go to the next slide, Laurence. I think I've got one more. So just I want to talk about the importance of hydration and nutrition. I know we talk about just jumping into aerobic or strength training and jumping into yoga, but you need to do a few things to prepare yourself, both before the activity and after the activity, to facilitate and aid in your recovery. It's super important to consider hydration and nutrition, especially in the context of inflammation. So proper hydration is critical during exercise to prevent and reduce the risk of inflammation. And again, I'm going to lean on the area of IBD here as well. This is probably particularly important for people with Crohn's, colitis, or any type of inflammatory bowel disease. Dehydration can actually exacerbate gastrointestinal symptoms and increase the risk of inflammation and injury to the intestinal lining. So good fluid intake before, during, and after activity can certainly help to support GI function. It's also important to replenish electrolytes lost if you're sweating somewhat during your activity. So, water is always excellent, but sometimes you need something a little bit more. So something like, I'll just name a few that are out there that you can get at your grocery store, and they include BioSteel, G2, which is a form of Gatorade, but it doesn't have all the sugar that Gatorade has. And a new one on the market right now is actually called Body Armor, and you can get them in Save-On. And Body Armor is based on, the base of it is coconut water, and it doesn't have any type of added sugar or anything like that. But those are some drinks that you can include in your activity regimen to help keep you hydrated and help you recover from your activity. And then just in terms of nutrition, there are several dietary strategies that can be helpful in reducing inflammation triggers and reducing chronic inflammation. So proper nutrition before, during, and after exercise can help mitigate, again, in the IBD context, can help mitigate GI distress. So just things like avoiding high fiber foods or high fat foods before exercise or activity, consuming easily digestible carbohydrates during prolonged activity. Maybe you're going for a long walk, or maybe you're doing a bit of a longer run if you are accustomed to that type of exercise. And of course, maintaining hydration with proper nutrition can reduce the risk of GI symptoms with inflammation. I think that's my last slide, Laurence. And I'm going to hand it over to Alex. And Alex will talk about the much more practical approaches to physical activity here.
Great. Thank you, Jeff. And yeah, just like Jeff said, I'm going to be going over a few more practicalities, hopefully some things that you can apply to your life and to your schedule, and chat through a few things on how LyfeMD can help and how LyfeMD, us at LyfeMD, can kind of assist you and team up with you in your exercise journey. So my first slide here is about barriers and limitations, and I've broken it up into two categories here. We have internal barriers on the left and external barriers. So a few of the ones that we'll be talking through, and talking through a few solutions or a few ideas on how to address them. We have in internal, we have pain in the body, movement restrictions. We have a lack of motivation. We have a lack of energy, and we have a lack of confidence or a lack of knowledge about exercising. So, what do I do? How do I exercise? What's the best thing for me? And then external barriers. I hear these things all the time, and I also deal with these things as well. I don't have the time. I don't have a place to exercise, and I don't have the right equipment. How do I exercise? So moving forward to the next slide, Laurence, we'll kind of talk about the first ones there. And I'd also like to mention, these are real issues that need to be addressed. But the thing is, they're not insurmountable in most cases. We can address them and we can do things about them. So pain and movement restrictions. This one's a difficult one because pain, it makes it so you don't want to move. Something that we can do, we have adaptable exercises. So I'll be giving a few examples on this, but we can progress exercises based on your difficulty level. We can adapt exercises based on your ability level. So at LyfeMD, that's one of the ways that we can help, is we can give you a program that suits you. And everybody's different, which is the beautiful thing about it. But everyone has a way that they can exercise. And another tip there, start small. Jeff didn't mention it, but he's an avid runner. He's run a few long races, and his son is following in his footsteps right now. I think, Jeff, I don't want to mention it, but he might be beating you now in some of the races, isn't he? Yeah. That's a tough pill to swallow. But you don't have, start small. You don't have to start training for a marathon, right? Something is better than nothing. I really like, I was going to mention this later, but Harvard, I read an article from Harvard Medical. They mentioned that if you do not exercise, the best thing to do is to do a 5-minute walk every day. And if you can do 5 minutes, mostly everyone can carve 5 minutes out of their day. If you can do a walk for 5 minutes and make that a consistent habit every day, that's an excellent base to then grow from there. Do a 10-minute walk, start other exercises. So, if you can do a 5-minute walk, you can progress to anything. Another one I want to talk about is water aerobics. So especially for people with arthritis or joint pain, anything in the water is really is excellent because it takes the weight off of your joints, but it still provides a resistance and allows you to move in a way that's meaningful. So the second internal barrier that we'll talk about today is motivation. This can also be a difficult one. Motivation. I don't feel like exercising today. Why, and a few recommendations I have. The first one is find your why. Find your why. And a question I often ask people when I have a consult with them is, where do you want to be in 6 months from now? Maybe it's I'd like to lose weight. Maybe it's I'd like to have less pain in my joints. Maybe I'd like to become stronger. I'd like to have more energy, play with my grandkids, play with my relatives. All of these things are excellent goals to have. And what my recommendation would be is to write it down, write your why down. And that really helps you set a goal and try to reach it. Another tip that I would have is to make a sustainable plan. So sometimes people, including myself, can bite off more than they can chew. And try to do so much. I'm going to work out every day. Just like Jeff mentioned, I think this is so valuable. You don't have to work out every single day in order to see these anti-inflammatory benefits. So to make a sustainable plan, starting small, making a sustainable plan is very important. Another strategy would be to join an exercise class. Some people in my family have done this, where you join a class and they have the workouts for you. There's a time you have to be there. They're counting on you being there. They have workouts. You don't need to think, and you can join a class. That's an excellent way to go through with it as well. And I'll ask for the next slide there, Laurence. 2 more internal barriers. So no energy, a little bit different than no motivation. Motivation is more a mental thing. Energy can be a physical thing. So this is a very interesting thing, that regular exercise can actually help you feel more energized. Now, I'd like to share a personal story. My wife and I started exercising more consistently about a year ago. And I remember at the start, my wife would tell me, when I work out, I just feel completely drained afterwards. And that was the case for a month or even a little bit longer, six weeks. And then it started changing, where we would do a workout or do some exercise, and she would say, I'm actually feeling more rejuvenated by this. So it's very interesting. I don't know exactly what it is. Maybe you're building up the strength, you're building up the cardiovascular endurance. And at first it can feel tiresome. Actually, regular exercise helps you have more energy in most cases. Another thing that you just should make sure that's happening is getting proper sleep and getting proper nutrition and hydration, like Jeff had mentioned earlier. You need to fuel your body for the exercise that you're going to be doing. And then on the right side there, confidence and knowledge about exercise. How do I exercise? So this is a thing where we can come in, LyfeMD can come in. We have a few programs available. One of them is our Motion is Lotion program. This one is excellent for people with joint pain, or people with arthritis, and people just wanting to start out exercising. I may talk a little bit more about Motion is Lotion in a few slides, but basically it only takes about 10 to 15 minutes to do a session. We recommend doing them about 3 times per week. And it's not a huge time commitment. You can do them in the comfort of your own home. It's a great program. So another option 2 there, is to do an exercise consult. And, that can be, you can hire a personal trainer. You can also come to us. We do exercise consults at LyfeMD. That's really good if you're looking for a custom plan. Maybe you have some limitations that we need to adapt to. And I have a story later on about someone who came with wanting a custom plan, a bit of a success story. So yeah, just another thing to mention, we have exercises available for every ability level, no matter if you're bedridden or if you are running marathons and working out every day. We have valuable exercise programs and strategies for all levels. So I'll go to the next slide there, Laurence, please. Now, external barriers. So time, a place to exercise, and equipment, or I guess equipment or things that you'd need. So time. This is also a difficult one, time. That's a very common one as well. I don't have time to work out. So the second point there, like I just mentioned, we have time efficient options like Motion is Lotion program. Just like the Harvard study recommended, to do even 5 minutes per day is a great start. 5-minute walk per day is just, so you don't need to be working out for hours. Just like Jeff said, the anti-inflammatory effects can be seen with moderate exercise, You don't have to be working out for hours and hours and hours. But the first point there, planning ahead and making a schedule. This is very crucial as well if you're finding it hard to find time to exercise. Basically, if your day is full, you have to replace something, a part of your schedule, with this exercise. Let's say it's 15 minutes. You have to carve out a 15-minute time in your day. It's not just going to appear. If you're feeling very busy, you'll need to prioritize that. So if physical activity is a priority for you, there may be something in your day that you can move around or take priority over that. For instance, watching TV. If you're watching TV, you can actually do a lot of the exercises we suggest while you're watching TV. That's a great tip as well. I know sometimes if you're cooking and you have something in the oven, do your 15-minute exercise. You're done before it pops out of the oven. So there are ways that you can fit it in. We might talk a little bit more about that during the question period. Place. You can exercise anywhere. Equipment. You can exercise with your own body. So one thing that everybody has is you have your own body weight. There are unlimited amounts of exercises that you can do with your own body weight. And that's a beautiful thing. You don't need any fancy equipment, things like that. And we have lots of different strategies that you can do, different ideas. Yeah, so Laurence, could we go to the next slide, please? Okay, I wanted to include this slide. This is a bit of the progression that we can do. So kind of showing how all levels can be accommodated for. So in progression 1, well, I'll just say all of these exercises are helping strengthen the glutes. That's your butt muscles or your glutes on the back of your body, obviously, and the back of your thigh, how to strengthen those. So for progression 1, we have the glute squeeze. This is something you can do in your own bed while sitting down. If you're bedridden, this is something that you can do. You can squeeze your glutes. And I hope some of you are trying it right now. We can all do a few glute squeezes. There we go, like my own self. But that's a progression 1. You're actually activating that muscle and giving it a bit of strength. So progression 2, glute bridge. You're laying on the ground with your legs your legs up, your knees up, and you lift your butt off of the ground. This is also activating the glutes and activating the back of your leg. And then progression 3 would be like a squat. And so these are 3 progressions, all trying to achieve a similar thing. The third progression may do it more efficiently, but if you're unable to do that, there are ways we can progress and regress the exercises. What's the next slide there, Laurence? I believe it's success stories. Okay, great. So I just wanted to share a couple stories of programs that we've had at LyfeMD and that have been successful with real patients. I had a couple quotes. We usually get feedback from programs or sessions that we do, and I have a few quotes here from some of the sessions. So I'll leave them unnamed, but here's one person. I just did day 1 of the Motion is Lotion program. It was great. I loved the slow pace and how quick it was. The time duration is perfect for me. In the summer, I'm more busy, but it doesn't mess with my schedule. And my son enjoyed it as well. He's 9 years old. The videos were super helpful. And another one, my pain is gone since I started doing the mobility exercises from Alex and the team. I can now go up and down the stairs. And so I hear stories like that, and a big passion of mine is to, genuinely to help people. And this just warms my heart and, can make me a little emotional seeing people progress and better themselves, and to hear I can now go up and down the stairs, and and maybe they couldn't have done that before, is just incredible. That was for the Motion is Lotion program specifically. I just want to share one more story. This was a private consult that I had with someone in December, so about 4 or 5 months ago. They came to me with through LyfeMD with an injury or a limitation that they had. I worked with them to do a personal custom exercise plan. And along the way, through the past 4 or 5 months, we recorded the progress, and I got them to do a lot of surveys on how they were feeling. So we did one questionnaire. It has a bunch of questions, and you have a score out of 84. The higher the score, the better. So in December, when we first started the program, they scored 67 out of 84 for activities of daily living. And for sport-related activities, they scored a 9 out of 28, 9 out of 28. And by the end, this was in March, we did a reassessment. The score jumped up. The activities of daily living score jumped up from 67 to 83 out of 84. And these numbers may not mean anything to you, but basically we saw a real improvement. And the sports scale, the sports score went from 9 out of 28 to 26 out of 28. So this means that this person was able to enjoy things that they weren't able to enjoy before we started the program. And I actually talked to this person yesterday. They said, I've just gotten back to jogging and there's no pain. And it's just incredible to hear stories like that. And I know that there may be many people listening right now that may be going through a difficult time with their bodies or pain or some sort of limitation. And I just want to give you hope that there are people out there just like you that are going through similar things, and they have, you know, these people put in some work. They've put in some work, that there's no questioning that. But they've seen some results, which is just incredible. I think we can go to the next slide, Laurence. This will be my last slide before we get into a couple questions, I think. I just wanted to leave everyone with 5 take-home tips. So my first take-home tip, that if you can get some practicalities home and remember these, is to start small. This is a great way to build a habit, is by starting small. Just like we said, we don't need to run a marathon. You know, if you have a big audacious goal, that's awesome, but it's okay to start small. You can build up from there. In my opinion, it is much better to start small and be consistent than to start big and fizzle off. So there's no shame in starting small. And, you know, after a month of doing something every day, it just becomes a part of your life. It starts to become a part of your life, and that and then it just becomes easier. So yeah, you don't need to run a marathon tomorrow. You don't need to lose 100 pounds tomorrow, but we can start small. The second tip is to define your plan. If you just say, I'd like to exercise more, I would argue that's not good enough. I want you to do 3 things with defining your plan. I want you to write down your goals. I want you to write out your specific plan of what you will do. For instance, I'll do weight training 3 days a week, or I'll go for a walk every day. Write down the specifics. And then the third thing is to schedule it in your week. If you have 3 days that you're going to exercise, plan which days those are going to be. I'm going to do Monday afternoon, Wednesday evening, and Friday morning, whatever it may be. But to actually schedule these out and plan them is key for success. Number 3, accountability. So if you can find a friend to keep you accountable, this greatly increases your chances of achieving your goals. This is another place that we can come in with LyfeMD. If you don't have someone to keep you accountable, that's one place that the coach can come in and keep you accountable. I did hear a very interesting stat. If you just tell someone your goal, just telling someone, it drastically increases your odds of completing your goal. If you are have a defined plan of when you're going to meet with someone, it brings your success rate up to 95%. If you are in line with someone else and you're both going to meet to achieve a common goal, or maybe you're working on different goals, you have a 95% chance of achieving your goal. So it's to have an accountability partner is a great tip. And so I encourage everyone, you know, define your plan, write it all down, write down your goals, and then tell someone about it. They can keep you accountable and hopefully encourage you to. Then, oh, sorry, Laurence, if you mind just going back one slide, there's just a couple more. Yeah, find something you enjoy, number 4. This is kind of borders on the physical activity rather than exercise, to just find something you enjoy, whether it be pickleball, taking your dog for a walk, swimming, biking around. And, you know, if you can find something you enjoy and it can turn into a habit, that's a great thing. It doesn't even feel like you're working out or exercising, but you're really having a benefit there. Number 5, be kind to yourself. And I would say that if you are in this webinar, that means that you are taking steps to better yourself. You're taking steps forward to make a change in your life. And I applaud you for being here today. I applaud you for taking steps forward in your physical activity journey. And yeah, you're doing the right things. I want to say it's okay to, you know, give yourself a pat on the back. Often the person that's hardest on us can be our own selves. So make sure to be kind to yourself and, you know, keep going. You can do it. Everybody's at their own place in their journey. So those are my 5 take-home tips. And I believe, Florence, we may be getting into some questions. So Jeff and I will be answering some questions that came in. All of these came in from people who signed up for the webinar. So we'll do our best here. We will do our best to answer all of these. And if I struggle with any of them, I'm throwing them on Jeff. So Laurence, yeah, sorry, go ahead.
Yeah, thank you, Jeff and Alex. We are going to get to the Q&A portion of the webinar, so we'll get it through as many as we can. We'll do some rapid fire questions and look at how we can answer these questions, whether it's Alex or Jeff or both of them. So we received a lot of questions, so let's just dive in. So the first one is, what exercises reduce inflammation and increase strength that are suitable for people diagnosed with gut diseases?
I'd like to take this one, Alex, if that's okay with you.
Please. Yeah.
It's interesting because the 3 women that founded LyfeMD all came at this from a yoga background. You know, and back in my previous life, I probably would have rolled my eyes at yoga and thought, no, you gotta pound the pavement with your running shoes and lift the weights and get on the bike and stuff like that. But the founders of LyfeMD had an incredible research program looking at the role of yoga in things like Crohn's disease and ulcerative colitis and irritable bowel. So gut health is really what they're looking at. And what they've concluded time and time again is that yoga is really one of the best things that you can do. And if anybody's done yoga, you know that it can be incredibly challenging. You know, you're doing a pose and your arms start shaking because you can't hold your body up anymore. But it's low impact. It's more of a moderate intensity. If you want, you can challenge yourself with those more challenging poses, which could get you up into that strenuous form of exercise if that's what you want to do. But in terms of, you know, if you want to just take it from a research perspective, and what is one of the best activities to do for inflammation and in the gut diseases, I would hang my hat on yoga as being one of the best things that you can do.
Amazing. Thank you for that. So number 2 is, I have rheumatoid arthritis and I suffer from wrist pain. I wear splints for spin and Zumba. Do you have other recommendations?
You want to do that one? And
Sure, yeah.
3. I can do 3. How about you do 2 and I'll do 3?
Sure. Sounds good. Yeah, so with arthritis, it's great that you're finding a way to be adaptable, wearing a splint for spin and Zumba. I would hope that some of those strategies are allowing you to do those things without pain or with less pain. But yeah, as far as the wrist pain goes and the hand, you know, wrist and hand pain, I saw a couple studies with rheumatoid arthritis that showed activity level, increasing function, and decreasing pain. So some strategies would be to do the moderate intensity aerobic exercise. And also, I do have a decent hand, just a video I found on YouTube that has some hand exercises. I believe those would be useful as well. I can put my email in the chat here, and if the person that asked this is here, you can email me, say, hey, can you send me the hand arthritis video? I'll send it over to you, but just to mobilize the hands. There's a lot of different things that you can do to keep them moving, increase strength, and to just increase mobility, even through your arthritis. I'm gonna put it in right now, and I'll send you a video. I'm happy to send it to anyone that would like it. But these are the types of things that we do in our IA, our Motion is Lotion program as well, is light and easy movements, trying not to weight bear on your wrist. So for instance, a push-up may not be the right way to do it, but we can adapt exercise. So I'm sorry, I can't tell you exact, exercises to do right now, but I'll send you that video if you email me. I just put it into the chat.
All right. Next question is, if you are already sore, pain in hands and feet, is it still beneficial to exercise through that?
Sorry, I kind of lost my screen. Can you hear me, Laurence? Okay.
Yeah.
Good. I'm going to go out on a limb and I'm going to say no. I don't think people should exercise through the pain. I think that's a very old school way of thinking, to put it that way. I think this is an opportunity where, if your feet are hurting for various reasons, or if your hands are hurting for various reasons, try and be creative and find something else that you can do. And I'm just going to throw one thing out there, and that's stretching. Stretching really gets overlooked when it comes to physical activity and just as a way to achieving overall health. Like if you look at, those core building blocks of health and fitness, stretching and flexibility is in there. And it becomes more important as you get into adulthood, like, more important for people, over the age of 55, 60. Strength, balance, flexibility become more important. So if your hands and feet are sore, I'm going to challenge you to maybe use those days to do some flexibility activities and, get your yoga mat, lay it out, and stretch out your quads, stretch out your calves, stretch out your back. And there's lots of great programs on YouTube that they take you through the stretching routine. And typically they're, 10 to 15 minutes. It doesn't take a long time. So I guess the long-winded response to that question is, maybe try to find something different that isn't using, I'm assuming maybe you're going for long walks or you're jogging and you're getting sore feet. You can do exercises where you're not on your feet. And Alexander mentioned aquatic-based activities as well. Those are way easier on the joints, takes all the weight off of your body. Yeah, so that would be my response to that question.
Thanks,
I'm gonna
Jeff.
try and get my screen back here. Hopefully I can get it.
So next question. Did you want to say something else?
No, I was just going to say, awesome. That was great.
Okay. Okay, next question is, what is somatic yoga and is it helpful?
Jeff, do you know anything about somatic yoga?
I don't know what somatic yoga is.
I don't either. I'm so sorry, I probably won't be of too much help, but the somatic yoga, I did just look it up a little bit. It's kind of more, from what I understand, more gentle movements, kind of like you could say gentle yoga, and it really focuses on a mind kind of muscle connection on, doing these more gentle movements. I could be totally wrong, so sorry if I am. But if that's what it is, I think it is helpful. We have a gentle yoga program with LyfeMD for people who are, having pain in their joints. And yeah, I'm a big, I really think that movement is good. You want to get movement in any way possible. Just like Jeff said, if you have pain, try not to do activities that increase that pain, but to get movement in your body is just great. So yeah, sorry, I don't know too much about somatic yoga, but if it's moving the body in a way that doesn't hurt, then I can definitely see a benefit there with that. So I might have to look into somatic yoga a little bit more.
Thanks, Alex. And the next question is, are there any physical activities that should be avoided?
I would say any activity that you don't like to do, any activity that you find dreadful and painful, and you can't wait for it to be done. But with that said, I do some of those types of activities. But um, in terms of if you're getting started into physical activity, and you're trying to find a way to maintain that activity and make it a part of, Alex talked about making it a habit. The best physical activity is the one that you enjoy and the one that you're going to most likely keep doing. So if you hate the stair climber, don't do the stair climber. You can get the same health benefits by doing some other activities that are a lot more enjoyable. But in terms of inflammation, like the beginning of my presentation, um, for you, you might need to avoid more strenuous and prolonged types of activities if that's a trigger for you. If that makes your joints painful, if you have IBD and that throws your gut health way out of whack, then obviously you need to avoid those types of activities as well.
All right. Next question is about exercise if you have arthritis in the knees.
Yeah, I would say there are many options for you. Like one of them would be the water aerobics. That's my first suggestion. Excellent. Just the way that the water takes your weight off your joints and then adds resistance is just perfect. I think, cycling, if it doesn't hurt, because, where jogging is an impact, cycling doesn't have that impact, right? Or even a static cycler or whatever, you don't have to be biking around. But those are a few ideas. Our Motion is Ocean program, we have a lower body program, or I guess hip, more focused on the hip, but we don't really have a knee program yet. But there's a lot of overlap in the lower body. So, those are things that you can do, not weight bearing on your knees, and those would help. But yeah, those are a few ideas.
Yeah, and this one is a good question because it's so common, and not just rheumatoid arthritis, but things like osteoarthritis in the knees. I just turned 47. I don't have knee pain yet. I run probably 50 kilometers a week, and one day my knees are going to start to get really, really sore. And whether that's rheumatoid arthritis or osteoarthritis, but there's a lot of things that you can do now. So, the science of shoes has really come a long way. Custom orthotics can really take a lot of the load off the knees and even the hips as well. So if you're an avid walker, or you're interested in jogging, it's super important that you have proper footwear. I know a physiotherapist can certainly, diagnose any issues in your feet that can maybe wreak havoc with your knees, and it starts with your feet and it can go all the way up, to your spine and your neck. Alex is a soon-to-be chiropractor, and I'm sure he can attest to that. But arthritis in the knees and knee pain just in general is so common. And I think Alex said it, you just need to be flexible and find those types of activities that kind of limit that stress and impact on your knees. But at the same time, you might be able to find a way around it by getting the proper footwear. Maybe you need some custom inserts in your shoes and things like that.
All right. Next question is, I'm interested in relieving hip pain with exercise. Is yoga the best way?
I don't know, Alex, what do you think?
Well, as you said earlier, I mean, yoga is a great way to do it for sure. I mean, it's complicated because in my opinion, it depends on the hip pain. There could be a variety of things causing the hip pain. So in my opinion, the best things, yoga is a great thing. A mixture between stretching and strengthening the different muscles. So if you can combine those two, stretching and strengthening, I believe that most causes of hip pain can help. It just really depends what is causing the hip pain. But for most people that I come across, they're doing a lot of sitting, and that's a huge thing right now. And people are getting lots of hip pain maybe in the front of their hip. and it's kind of pinching and things like that. And stretching and strengthening is great for that. So it really depends what the pain is, but stretching and strengthening and yoga. Keep doing yoga. It's great.
Yeah, I think one thing with hip pain, I mean, it's not nice, but the nice thing is a lot of forms of hip pain can be preventable or can be prevented with, like Alex said, proper stretching. Like your hip pain might be coming from things, gosh, I want to say iliotibial band syndrome, I think is maybe one. You've got a band that comes up from your knee up to your hip, and if you're running or cycling, that band is snapping back and forth over the hip joint. A trip or probably multiple trips to the physiotherapist or the chiropractor can help with that, and they can provide you with stretches that can reduce that type of hip pain. It's a little bit different when you get into things like if you have osteoarthritis in your hip or just general rheumatoid arthritis. Um, that's a little bit different because I know that just simply doesn't go away with stretching. But again, I don't want to sound super repetitive, but there's lots of activities that you can do that will give you health improvements that don't necessarily involve constant movement of the hips. Focusing on your upper body, stretching, cycling typically can be a little bit easier on the joints. But and again, I'm going to go back to what I talked about with arthritis in the knees. The knees and the hips, a lot of it starts in the foot, and a lot of it starts with your biomechanics. So, if you don't have arthritis or osteoarthritis in your hip, I highly recommend a appointment with your physio or chiropractor.
Next question is there a link between migraine post-running and J
Mhm.
pouch surgery? Already drinking a lot of water with electrolytes?
Okay, Alex, I'm going to take this one if that's okay with you.
Please, yeah. I'm curious to hear what you have to say.
I can't speak to the J pouch surgery, but I can speak to migraine and running. So I was a migraine sufferer since grade 6. I still remember the first migraine I got in school. I had the blurry vision, the bright lights, and everything. I didn't really know what was going on. It's something I lived with not chronic, but probably once or twice a month. I would get a migraine about half an hour after a long run or a good run. I mean, anything over 5, 6K. Until one day I was running and I actually had a stroke. And it turns out that the stroke was because of a hole I had in my heart. It's called a PFO. And that hole in the heart is also linked to migraine. So what was happening for me is as you're exerting yourself, blood is spilling over into the wrong side of the heart and going up to the brain. And that's triggering migraine. So, I mean, it was nice. I had a stroke. It was nice because I knew exactly what caused my stroke. I know a lot of people have a stroke and they just really don't know why they had one, and it can be very stressful. Um, so, migraine and running, there could be a lot of different things. I mean, there's one thing that, it could be linked to, an anatomical heart defect, which is what I had. I mean, it's somewhat rare to have it as extreme as I had it, but I can't speak to J pouch surgery. That's just not an area that I'm familiar with, so I don't want to pretend to be an expert in that. I don't know, Alex, if you can speak to that at all.
I'm not an expert either, but for anyone who has had their colon or a portion of their colon removed, large intestine and colon, that's the same thing. Your large intestine helps with absorbing electrolytes. So I see where this question is going as well with the electrolytes. Yeah, and Jeff, you've got the migraines covered. If it's just a headache, if it's a migraine, I'd go with everything that Jeff said there. I don't know the answer to the electrolytes thing, but I see where you're going there with, maybe with less of your colon, you're not absorbing electrolytes as good, and then you don't have you get a headache from that. It's possible. I don't know the answer, but that's kind of where my line of thinking was going there as well. If that was a link between the J pouch, but yeah, anyways, sorry, I can't give a full answer regarding the the surgery there.
There certainly is a link between hydration and migraine activity. Yeah.
Next question is, can exercise help with fatigue and depression as well as chronic inflammation, and how?
I feel like I keep jumping out to these questions. Alex, do you want to try that one?
Yeah, I can start and maybe you can. I know, yeah, like Jeff explained, I think Jeff explained pretty well of the inflammation part. I would love to add the depression part. When you exercise, your brain releases chemicals, endorphins, serotonin, those might be things you've heard of. And these have an impact on your bodily function and they make you feel a certain way. The way that many antidepressants work is actually increasing the activity of serotonin or some of these endorphins. And it's just incredible when you figure out that exercise does that. So not to say that you don't need antidepressants, you don't need medication, you can go off, but I'm saying that, it's almost like a free antidepressant that you have of exercising. And, lots of people struggle with depression and it's not an easy fix. It's not as easy as just getting up, going for a jog and you're all better. But when you're physically active, it can help, certainly. And yeah, Jeff, do you have anything else to mention?
Yeah. I think the last LifeMD webinar I did, we talked about a lot about fatigue. But yeah, certainly exercise is one of the best things that you can do for fatigue and for depression. I want to speak to the depression one because in the last couple of years, there have been a few large systematic reviews come out looking at all of the physical activity interventions and their impact on depression. And what they do is they compare it to studies that are looking at different antidepressants and how big that effect is on depression. And they find that the effects of exercise on depression are pretty much similar with the effects of antidepressants on depression. So I'm not an advocate of just doing one or the other. I'm an advocate of both because we know that the research suggests that your magnitude of benefit is going to be the strongest by combining exercise with whatever antidepressant your physician describes you. And then just to touch on fatigue, I've published a lot in the area of fatigue in the cancer context. And what we have found there time and time again is that people who are active and meet what we call those public health activity guidelines, and I think right now, I think it's 150 minutes of moderate intensity a week is what you should aim for. Those people have a meaningful amount less of fatigue. So they call it a clinically important difference compared to people that aren't meeting those guidelines. So just simply meeting guidelines on the fatigue scales or the way that we measure fatigue, people show a clinically meaningful difference in their amounts of fatigue.
Amazing. Thank you. I just want to let you guys know, I know we're going a little bit over time, so we're powering through these questions. I know some people had to leave, but if you can stick around, we're going to be getting through these questions and then wrapping up. So just want to let you guys know we'll be getting through these questions. And then if we can't get to your questions, we will reach out and answer them. So don't worry, your question will get answered. The next question is weight training okay?
I'm going to say absolutely. And I think we showed it with that recent systematic review I talked about earlier in the hour. Many of those studies were looking at strength and resistance training and the role that they play in inflammation. And I think the three things that most consistently came out were aerobic training, resistance and strength training, and yoga in terms of having anti-inflammatory effects. So, and especially as you age, so as you get older, maybe you're middle-aged and moving into older age. I just turned 47 the other day. I certainly feel that way. Apparently, the research says, and I don't really do a lot of strength training myself. I'm a runner. But as you age, strength training becomes more and more important, especially when it comes to activities of daily living, functional health outcomes, things like strength and balance are critical as you age, and they're strongly associated with healthy and active aging. So I think weight training is it's not just okay, it's something that I think that you should be incorporating into your activity routine.
All right, thank you, Jeff. So next question is, when should you know to stop? What is the difference between a workout ache versus potential injury?
What do you think, Alex?
Sure, yeah, I can start on this. Yeah,
Yeah.
it's a good question. How do you know if this pain or soreness is really bad or if it's normal, normal to work out? But I would say, Jeff said he would recommend not to push through any pain. So I think that's a good thing to start with, is if you're feeling pain during an exercise, I'd recommend to stop that. And, just like I said, we can adapt things, right? Now, potential injury, the big things that would ever injure you is if you're doing an exercise with improper form or you're doing it with too much of a load. So those would be the two big injury areas. And if you're getting some advice from somebody, maybe it's a trainer, maybe you're being observed doing the exercise, that helps with your form. If you're gradually increasing your load, that helps with the load to not overdo it. So starting with body weight things is great. But yeah, you're gonna feel a little bit sore after working out. I think during the workout, you shouldn't feel too sore. It shouldn't be a sharp pain. Maybe a little bit uncomfortable. That's okay. Sometimes we do range of motion exercises that aren't too comfortable, but it's okay to push through. So, yeah, it's a great question. I'd say sharp pain, stop. I don't know, Jeff, what would you say?
Yeah, I agree with that. Yeah, it's a tough question. I mean, sometimes injuries creep up and you don't really know. Like it's not there's not a clear tell sign that you're doing too much. Um, but with the workout aches, I mean, those are going to happen, especially if you're doing something like strength training and lifting weights. As you go up in weight, the body's amazing. It's going to adapt. And when you start your exercise program, it may seem really, really hard, but if you stick with it, you feel your body change and things get easier. So then what do you naturally do? You put another weight on the thing, or you go up to the 15 pound weight as opposed to the 10-pound weight. And essentially what you're doing there is you're tearing the muscles a little bit, right? As you lift heavier weight. And so you might get a little bit of a workout ache. They call it delayed onset muscle soreness, and that can creep up, 24 or 30 hours after the activity. So, those dull aches and, your quads might be sore if you went for a long walk. And I would say those are somewhat normal, but I think Alex said it, anything sharp, anything that's radiating, anything that's shooting up from your foot up to your knee and then up to your hip or your lower back, that might be a sign of something a little bit more serious.
Thank you both for those answers. So the next question is, our second to last one is, how do you fit in exercise? Morning isn't an option, and I'm so tired by the time I finish the workday.
Yeah, it's funny. I used to run early in the morning, and I used to run every morning early in the morning, like 6 a.m. early, and it wasn't fun. I felt good after because I got my coffee and it was a nice feeling to have your kind of your exercise out of the way for the day. You can check that box. But I certainly get it. I certainly understand the challenges of finding that time. Um, especially when morning isn't an option and you're tired by the end of the day. That's one of the thing, I mean, kind of going back to that fatigue question, we always talk about, finding out when during the day you feel most fatigue and then scheduling exercise around that. That's, if you're busy in the morning and you're busy, later in the evening after the workday, then, you need to find something in there, whether it's at lunchtime or whether it's at night. Another thing you can do is you could kind of um, rethink what your ideas about exercise look like. Maybe you're thinking, I got to go jog on the treadmill. When in reality, I mean, maybe you take the dogs out 3 times a day. You do that in the morning, when you get home from work, and then later in the evening, and you can turn that into activity. Get yourself a little step pedometer, or I don't know, maybe you have an Apple Watch or something. I'm still a big advocate of monitoring and counting your steps. If you can find a way to count your steps, every iPhone will do that for you. If you have your iPhone in your pocket, you can go to the health app and it will have your steps. You don't even know it's counting your steps, but it is. So there's maybe things that you're doing throughout the day that could really count for activity. I'm a big dog walking fan. I've got 2 dogs who are asleep right here, and they're waiting to get out for the next walk. But it's good for you and it's good for the dogs as well. And challenge yourself with how many steps you're doing. But at some point, it's also good to challenge yourself with improving the cadence of steps. So walking faster, which is the easiest way to put it.
Awesome. So the last question is it possible to train for a half marathon while in a flare? I have difficulties maintaining a target zone of no more than 3.
I've trained for half marathons and ultra marathons, and I don't have GI issues, so I'm not going to pretend to know what that experience is like. I don't know, Alex, if any of the people that you've worked with through LyfeMD have been working towards some more longer endurance activity goals.
Yes, but when I think back to different cases, I don't know if the GI symptoms or the flare symptoms coming into interfering. I don't know if I've worked through that often or at all. So with somebody. So yeah, no, I'm on the same page as you. I don't know what that's like, and yeah, I'm curious to hear what you have to say. I don't know if yeah.
I think like earlier in the presentation, I talked about, everybody's different, right? Everybody has different triggers, um, you know, based on your gender, your age, your lifestyle, your stress levels, all of those things contribute to flare. It might not just be the fact that you're training for a half marathon, or maybe you're pushing it too much. I think it's really good. And this is something where some of the LyfeMD coaches could maybe help, but, looking at diet and looking at your hydration patterns or your hydration habits, and not just, when you're eating, but what you're eating, and even almost more importantly, what you're drinking. Training for a half marathon, sometimes water won't cut it. You need something else. Like you do need some sugars. You do need those electrolytes. Um, so I would encourage you not just to think about, jogging while in flare, but thinking of the bigger picture and looking at everything else, and looking at nutrition, and in particular hydration as well.
All right. Thank you both for answering the question, sharing your expertise. We will be wrapping up the questions for the night. I know we've gone over time, so thank you all for submitting your questions. If we weren't able to answer your question, don't worry, we will reach out to you to get it answered. Before we finish off for the night, we did want to let you know that we have a sweet deal for you if you are wanting a custom plan for your exercise routine. If you want to book a private consult with Alex, our health coach, you can receive 20% off your exercise consult when you book in the next 24 hours. So feel free to take a picture here, take a screenshot. If you have any trouble with the booking or have any questions, please reach out to us or to your health coach. And we'll be wrapping up there. So thank you so much for everyone who joined. Thank you to Jeff and Alex. We learned so much from you guys. And again, we appreciate all of you coming and participating and being here tonight. Don't forget, before you hop off, super important, when you hop off our call, you will see a pop-up with a short survey that will ask you like 2 questions. We really value your feedback to help us improve future webinars. We really appreciate your answers there. Otherwise, thank you everyone for joining us today. We hope you enjoyed it, and we look forward to seeing you next time.
Thanks for having me, Laurence. Thanks, Alex. And
Yeah,
thanks.
thanks so much. This was great.